Join me, Mark Windows, for Windows on the World live every Sunday, 9 to 11 p.m. GMT. Check out our archive and program stream at windowsontheworld.net. Welcome to this special from windowsontheworld.net. We do a new show every Sunday, 9:30 p.m. UK time, and you can find that on the live shows at windowsontheworld.net. Goes out on a platform called Spreaker. We also put all of our shows onto Odysee, all the links on the homepage at windowsontheworld.net, along with our Discord server, where you can engage in enlightening and useful conversation. And that's what we're going to be doing today. I'm going to be talking to Dr. Paul Hobday, a now retired doctor who was looking at how the NHS had been broken up and privatized over many years. And he's written a book about it called The Deceit Syndrome. Now, we're going to get today into how all of this ties into the global bigger picture of, obviously, private health insurance and the new global system, which is all done through sustainable development. And this is a subject we talk about on most of our shows because it's the thing that is not talked about, how global governance ties into basically health security. So before I bring in Paul, I'm just going to read you something which was from an off-the-cuff meeting in 1969 by a Dr. Richard Day for the Pittsburgh Pediatric Association. Dr. Richard Day worked for the Rockefellers and also for what became the Bill and Melinda Gates Foundation. It was known then as Planned Parenthood. Planned Parenthood, of course, still exists. But he gave this lecture and he talked about how things would change. And it was the whole world system which we see now. Everything that Dr. Richard Day said in this off-the-cuff lecture came true. Therefore, it does have a lot of credibility, and you can find that anywhere as the Order of New Barbarians. You can find it on Odysee, the whole thing, or windowsontheworld.net. Have a look for the articles called Social Engineers Then and Now, and Social Engineers Creating Confusion, and they are tied into another document which brings up everything that was said at that off-the-cuff lecture. So let's get into it. Basically, Dr. Richard Day, 1969, said the solo practitioner, the doctor, would become a thing of the past. A few diehards might try to hold out, but most doctors would be employed by an institution of one kind or another. Group practice would be encouraged, corporations would be encouraged, and then once this gradually became more and more acceptable, doctors would be more and more basically defined as employees rather than independent doctors or contractors. And along with that, of course, unstated but necessary rather, is the employee serves the employer and not the patient. And Dr. Hobday is going to talk about that today and how that's actually become a reality. And it said, ultimately, there would be no room at all for the solo practitioner after the new system is entrenched. And I think we can all say that that has actually happened.
The health minister has had a duty to provide care until Lansley got rid of that in 2012, when he said it's not a duty anymore, we just want to promote care. Now they're getting rid of the need to provide secondary care for people altogether. What that actually means is that when the budget, the fixed budget that these integrated care systems, the 42 in the country, are given, when the budget runs out, they will be able to legally say, sorry, you cannot have your operation because we've run out of money. The choices for you are you go without or you pay for it. The other big change is that, which comes to the Richard Day prediction as way back as 1969, is to break the doctor-patient relationship. And to herd GPs into big hubs. Now, in part of the 5-year forward view that came out some years ago under Simon Stevens, who I must remind you worked for the American healthcare system before he started plotting against the NHS. In that, they are planning to reduce the number of GP practices from 7,500 to 1,500. So you will be traveling a long way further for your healthcare. Now, the new ideas of bringing in tech, as you've seen with the COVID and to try and make it as hard as possible for you to see a GP are part of this, because they don't really want you to see a GP. They want you to see the cheapest healthcare assistant they can. And if you jump over quite a few hurdles, you might eventually get a Zoom call with a GP. But it's very difficult to actually see a GP. And what they really don't want is you to develop a relationship with one particular GP. They want you to be able to they want you to feel free to settle for any advice you can, which is all very well for the old middle-aged white man with a knee problem, but doesn't work well with older people, younger children, etc., particularly older people who need a relationship with a doctor. But they're going to break this and make it quite difficult for you to see GPs. Now, I won't go on much further, but one of the interesting sidelines of this is when I first qualified, the patient had instant access to me as, without blowing my own trumpet, as a 10-year qualified, having gone through 10 years of training as a GP. So patients had the first port of call was with somebody that was the most highly skilled. That meant that there was less risk taking. That meant there were less mistakes. They're reversing that completely. Now your first port of call will be with the least qualified person, who will, through no fault of theirs, be out of their comfort zone, out of their skill set, and make mistakes, I'm afraid, by following algorithms on a computer screen that will put people's lives at risk. You hear things like physiotherapists. Why not have direct access to physiotherapists? Well, that's fine if you get the diagnosis right in the first place. But if you ring up one of these healthcare assistants and you say you've got your shoulder pain, and they say, fine, you've got a shoulder pain, go and see a physio. Have they ever seen somebody that's presented with shoulder pain with an intra-abdominal malignancy? Because I have several times. It's a common mistake that you get shoulder pain from your cancer in the gut. They're not going to be picked up early. They're going to be picked up, when it's too late, by the mistake of going to have physio for their shoulder, when the shoulder pain is nothing to do with their shoulder. These are the risks that people are going to have to face.
Join me, Mark Windows, for Windows on the World live every Sunday, 9 to 11 p.m. GMT. Check out our archive and program stream at windowsontheworld.net.